So our next speaker is going to be Dr. Lillian Gandor and Ms. Jumana Khalud from the American University of Beirut. The floor is yours, and please just take a minute or two to introduce yourselves.
Hello, everyone. So glad to be part of this very important global event. My name is Lillian Ghandour. I'm an associate professor of mental health epidemiology at the American University of Beirut and the coordinator of the PhD epidemiology program at the faculty as well. And my research focuses on mental health of young adults' mental health, including substance use.
Hello, everyone. My name is Jumana Khalud. I'm an instructor of public health practice at the Center for Public Health Practice at the Faculty of Health Sciences at AUB. And I work on practice projects at the faculty. I am the project manager for the mental health initiative that we're going to present, where Dr. Ghandour is the main technical lead on that project. Can you see our screen?
Yes. Yes, I can see.
Okay. And slide
could everybody, if you're not presenting, just go off the camera just to give them good wavelength place.
Can you see it in presenter form?
Yes.
Yes, we can see you, and we can see the slides as well.
Okay, excellent. Perfect. Oh, they appear so tiny on our end. Let me see if I can figure out a way to this one. Nope. Okay. You can see them all still? Okay. All right. So our presentation today is going to be about trying to cultivate a culture of mental health, wellness, and well-being at a university. The idea is that we've done this at the American University of Beirut as a pilot, but the idea is to see how well it has worked in the hopes of adopting it and adapting it to other contexts and other university populations as well. So we thought we'll start with maybe just a quick background of where Lebanon is, since this is a global event. We are a small country in the Middle East, bordering the Mediterranean Sea. It's quite a small country, but it has had a very, very rich history over the several decades. We've had a history of lots of uncertainty, political uncertainty, economic instability, and continuous security threats, all of which are obvious threats to one's mental well-being as well. And since 2011, with the Syrian refugee crisis, we've been one of the major host countries globally as well, with the highest ratio per capita and per square meters in the world. So we have about 1.5 million registered Syrian refugee population, but the numbers are way beyond that in terms of unregistered Syrian refugees as well. And in addition to that, in 2019, in October 2019, the revolution started, and so there has been a downward economic and financial crisis since then. We've also, as the globe has as well, we've experienced the COVID pandemic, which has led to a lot of intermittent lockdowns and closures, which also affected the population's mental well-being. And I'm sure the whole world has heard of the August 4th port explosion in 2020, which also left a lot of people in and outside Lebanon devastated. Having said that, pre-crisis, we knew that mental health was also a burden among the community. These are two studies that were conducted within the community. And let me just show you that 26% of the children and adolescents that were surveyed back then. So this is study number 1 that was conducted in the greater Beirut area. Beirut is the capital city. And so what we did is we sampled young children and adolescents aged 12 to 17, and we screened them and we used the DAWA. So using the DAWA, we found that actually 26% had one or more mental health disorders. What was really shocking for us though is not just the number of people with mental health disorders, but the number that has actually ever sought any kind of mental health care. And this is not specialized services. So this is not necessarily psychiatrists or psychologists. This is any kind of care for their mental health symptoms. And you can see that it's only 6%. So there's a 94% treatment gap there. We repeated the study using a national sample a few years later, and we found also, but this was more of a screening for mental health disorders rather than diagnostic. But we found also that about a third had any kind of mental health problems or mental health disorders, and again only 5% had ever sought treatment. So the treatment gap that is observed globally is obviously also global, observed nationally. So with all this in mind, we wanted to look into the AUB population because we are part of this community. And we found that, and this Office of the Student Affairs had been collecting information and data on the mental well-being of their students. And, with the shift in learning modes, if you recall, back in 2020, 2021, we had to shift to online learning modes, and that put a lot of stress and anxiety on the students as well. In addition to the economic and social instability and the fact that some students had to go back and live with their parents when they hadn't been living with their parents for a long time, and vice versa. And so there was a lot of demand on the mental health services that were existing, and there was a lot of overbooking. So there was high demand and obviously very limited supply given the enormous demand that happened also suddenly. But there was also, it was felt that there was also some kind of, lack in mental health literacy among students, faculty, and staff. And this is what triggered basically triggered the need for a mental health initiative at the AUB community level. So just to give you a quick background of what we do at AUB in terms of mental health, there is an AUB Mental Health Council that's been operating for the past few years now. I'm a member of that council, and we go over a lot of the policies and procedures related to mental health. For example, we try to ameliorate the insurance coverage for students when it comes to their mental health, increasing the number of psychology sessions and so on and so forth, just to make sure that we are meeting the demands. But there's a lot of work that's also done at the AUB Office of Student Affairs and at the AUB Medical Center. And so together there's this participatory approach to addressing mental well-being. We are a group of, let's say, faculty at the Faculty of Health Sciences that decided that it was high time that we addressed mental well-being of students more specifically. So we sought and received a MasterCard Foundation a grant, and as part of the grant we had 3 components to address: the mental health e-course, which I'm going to be presenting, and the peer support program and the training of the faculty and staff, which my colleague Ms. Jumana Kalot, who is also the manager of the entire grant, is also going to be presenting. Let me just tell you what the e-course is. So the e-course, as the name denotes, is a course that we developed in a very multidisciplinary and a participatory approach. Multidisciplinary is basically because we, as you can see, we collaborated with psychologists, psychiatrists, other public health experts, instructional design experts with IT to make sure that it's actually, a course that looks attractive and is aesthetically acceptable by the students. And of course, the primary stakeholders were involved in the process, who were the students. And we don't have time to go through the details of the process of how we ended up, doing the whole, the whole project. But rest assured that every single step of the process, the students were actually involved in the decision making and in the feedback. So the module, the e-course had 5 modules, including a conclusive module at the end. Just going to give you 10 seconds to read through the titles. There was an introduction to mental health. The second module was about common and mental health problems in youth. And here it was, you know, because anxiety and depression is kind of like common knowledge for many people. So what we did here is we also addressed some other severe mental health disorders, including substance use, so that students are aware of what constitutes a mental health problem beyond just anxiety and depression, which seem to be common knowledge in at least in our population. We taught them about the critical mental health signs and symptoms, and the idea behind this module was to increase identification and mental health literacy so that they can actually either seek care themselves or help others in seeking care, their friends. We taught them a lot of self-care and coping strategies, terms that they were not familiar with, and the evaluation actually showed us that they were quite happy with the fact that we had introduced these concepts to them. And obviously, Module 5 is how to support others in need of mental health support. This is just some screenshots from the e-course. What is anorexia, for example? People are, maybe young people are not quite aware that eating disorders are mental health problems. And then this is another example on, for example, defining for them what is emotion-focused coping when you have stress. And we showed them a lot of, we taught them a lot of emotion-focused coping strategies. And, you know, the concept of reframing, what is reframing? And we gave them some tips, key tips for reframing. And so I don't have time, we don't have time to go through the evaluation findings or the details of the evaluation, but let's, we did a process, we did content development evaluation, we did process evaluation, and we did impact evaluation. And we are in the process of writing up the 2 papers, one explaining the process of developing this e-course, because it's important in terms of knowledge sharing, to share it with others, and also the evaluation of the e-course. In the interest of time, I just want to show you some of the, it's slow, right? Some of the, you know, the statements that were shared by the students. I like most, what I like most about this course is the reassurance that everyone struggles with mental health. And I found specific numbers adhere to the credibility. So this is what we really strived on working on, to make it sure that it's contextually relevant, right? So this is not an e-course that's been adopted from a Western population. All of the examples were local. All of the examples were relevant to the students. And so this is why we advocate that anyone who eventually, for example, does such an e-course, make sure that it is relevant and acceptable by the students. And I am going to leave the floor to my colleague to talk about the peer support program and the training of staff.
Yes, thank you, Lilian. So to complete the loop of the mental health initiative at AUB, we have the mental health peer support program and the training of faculty and staff. The aim of the peer support program is to grow the enabling environment for normalizing the mental health discourse and promote healthy peer dialogues. So we developed an intensive process for developing the mental health peer support program at AUB, starting with mapping of existing services, because we have peer support programs at AUB. So we wanted to see what are these peer support programs, and we used an evidence-based participatory approach to identify the gaps needed and develop a sustainable, and I here quote, the sustainable program for mental health peer support, and then towards offering the service. We can say after a rigorous selection process and intensive training, and the content of the training is in front of you at the slide, we have now 16 dedicated peer supporters who abide by certain logistical and ethical obligations. So all of these points that you see in the list that the peer supporters have been trained on. So now we have at the Counseling Center an established peer support, peer-to-peer support program on mental health. The third part of the initiative is the training of faculty and staff. So in the training of faculty and staff, we have different target groups that are frontliners and in direct contact with the students, and faculty who teach the students. So the main target audience for us, depending on their role, we had the student housing staff and the protection officers. Each have their own roles in crisis management. So we did training for the housing staff and the protection officers. And as you see, the training for housing staff includes different topics, signs and symptoms of common mental health disorders, communication skills, how to intervene in the crisis, de-escalation and suicide screening, and referral mechanisms. You know, the students stay in the dorms for 3 to 4 years, and it's important for our housing staffs, the dormitory, to be able to screen and connect with students and support during mental health crises. For the protection officers, they have a small intervention where they pick up the students if there's any crisis, and they take them to the emergency room. So if there is an emergency at the university, we train the protection officers on core topics related also to signs and symptoms, when to intervene, and de-escalation techniques, and dignified restraining methods, and suicide screening. Of course, the referral mechanisms and self-care. So what are the take-home messages from our mental health initiative? It's important to use a holistic, interprofessional, multidisciplinary, and participatory approach. As Dr. Gandour said, acknowledge the importance of contextualizing and adaptability of the material. All the case studies that we use in the mental health e-course are contextualized to the Lebanese context. It was important to have institutional support for sustainability and impact. Now we have all the support from the institutions, and the mental health e-course is institutionalized at AUB. The training of staff is institutionalized. I forgot to mention the training of faculty. Faculty members are academic advisors for students, and we are developing a short e-course for faculty to take it and also do de-escalation and screen the signs and symptoms of mental health disorders. So we achieved success, hopefully, through adoption of intervention and a more mental health literate community. Our aim is to increase the mental health literacy and change the discourse about mental health in our students. So this is the project team. As you see, we have different consultants on the project and backgrounds, and they are multidisciplinary and diverse. And we strive, this is supported by the MasterCard Foundation Scholars e-learning initiative. And this is a picture of our students enjoying their university life and hopefully having a good mental health in AUB. Thank you very much.